Hello guys, this is Indian Medico, and in this video we'll see about tests for tubal patency. Tests for tubal patency are useful in the evaluation of female infertility. It is important to remember that all tests for tubal patency should be performed in the first 10 days of menstrual cycle to avoid disruption to a potential early pregnancy. It is also important to remember that all tests for tubal patency involve some degree of instrumentation of uterus, so we have to give prophylactic antibiotics. Now let us see about the various tests. First, let us see about Hysterosalpingogram. In this case, we inject contrast medium into the cervix and we take real-time X-ray to visualize the progress of contrast medium through uterus and tubes. Hysterosalpingogram demonstrates shape of uterine cavity, tubal patency, and morphology. This picture shows a normal hysterosalpingogram. This is the uterus, this is the left, and this is the right tube with normal spill of dye. Now let us see about Hysterosalpingo contrast sonography. As you can see in this picture, it involves saline injection through cervix and visualization with transvaginal ultrasound. It shows polyps and fibroids more clearly than hysterosalpingogram, and it is useful in the evaluation of tubal patency. Now let us see about laparoscopy and dye. In this case, laparoscopy is performed under general anesthesia. Then methylene blue dye is injected through cervix into the uterus. If the fallopian tubes are patent, dye can be visualized as it fills the tubes and spills from the femoral lens into the peritoneal cavity, as you can see in this picture. Any tubal blockage identified can be assessed for suitability for tubal microsurgery during laparoscopy. An advantage of this procedure is it allows demonstrating an immediate treatment of any endometriosis. That is, it is both diagnostic and therapeutic. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.